Hello, everyone. I'm Kanika Chadda Gupta. I'm a TV journalist and host of That's Total Mom Sense. And today I'll be joined by Dr. Elizabeth Cherot. She's the president and CEO of March of Dimes. I am so excited for our chat. It is very timely, and we're going to get into all things maternal and birth, infants, moms, and even the health crisis that I think everyone should be aware of. So we're going to get into that. March of Dimes is the leading nonprofit in the US working to improve mental and health outcomes for all mothers and babies. And Dr. Cherot is leading that effort. So it's an honor to have her joining us today. Okay, let's stand by. In the meantime, tell us where you're joining from. We'd love to see all the cities listed. Hi, Sue. Nice to see you. Thank you. Thanks for the compliments. Okay. Stand by. We're going to have March of Dimes with us very soon. Thank you all for your patience. I assure you this is going to be a very enlightening discussion. So stay with us. All right. Hey, Dr. Jerome, welcome.
Super. So glad to be here. Thanks for having me.
Of
Appreciate
course, of course. Well, I wanted to start with the mission of March of Dimes. It was the brainchild of President FDR. Tell us about the origin story because it's great.
Yeah, it is. And when I first joined the March of Dimes, actually a year ago, which is kind of this week, um, the history is phenomenal. It started in 1938 when FDR asked all Americans to fight for polio, to end the polio an epidemic that was happening in the United States. And so that started with a foundation of, actually, I laugh, it's sort of like the original crowd source funding, right? Like asking people to mail in, even if it's a dime, to the White House. And that funded the research, which, created the vaccine. And then we shifted from really infant paralysis and birth defects, which we still work on today, to preterm birth, maternal care, and to what we're fighting for today, which is the maternal and infant health crisis. Unfortunately, that the United States, a lot of people don't know, have some of the worst outcomes than other industrialized countries, and especially for Black and brown moms in the United States. And so that's the long 80, we're going on our 86th year of really being a non-for-profit that focuses on moms and babies. We fund research, we do education, which is part of this, right? But we also do a lot in government affairs, as well as data. And great programs that we do across the United States in our markets.
Yes, 100%. And I love that you talked about the three pillars. So there's research, education, and
You
advocacy.
got it.
And I loved the report that you shared before Congress.
Yeah, yeah. No, I
So
got to
yeah,
testify. I mean, it's like check the box, right? Something I never. It's kind of like some people that want to run a marathon. It's like I wanted to get in front of Congress and let them know how bad, right, our outcomes are, and so they reauthorized the Preemie Act, which was fantastic. And yes, we put out a ton of data. We put data out on maternity care deserts, which came out in August of 23, and we put that out on a yearly basis. And then we put a report card out, which was in November of 23, and tons of data that gets into the county level, which I think is just fascinating. Everybody should go to marchofdimes.org and go to our, you can look up your own county, your own state, and see where there isn't access to care, or there is, or what the outcomes are for both moms and babies. And we use a health equity lens. We report on a ton of stuff. It's phenomenal data that I really love to promote. So yeah, we get people to go into marchofdimes.org to our report card.
yes, yes. Please do so. I have it up on my laptop here
Cool.
right now. So let's dive into this 2023 report card. The U.S. earned a D+,
Yes.
which is abysmal. And this is in the state of maternal and infant health. Tell us a little bit about what that means when you're grading, what this rubric, can be called.
So the report card, just like you do for when your kid goes to school, Hanukkah, right? Mm-hmm. It gives you kind of a goalpost. Where are you, right? And where is the state of the United States? We're failing, right? We are not passing, and it's not getting better, right? So the trend is really that it's flat, our preterm birth rate across the United States. And if you look, there are states that are doing better, like California, and New Hampshire. So you start to think, what are they doing in those states, right? That's one aspect of it. But then you really look at what it's like for Black and brown moms, what it's like for access to care, and you can really dive in. And then there's patient stories actually for every state, which I think is super important because you really need to know about the lives behind, right, the real stories behind the data. And I think the heat map that pops up at you can just see the swath in the southeast of where preterm birth is the worst. And again, when you start to look at it, nobody got an A, which is utterly disappointing, but it also just tells you where's the trend, right? Where have we been going? Because it'll show you that, 10%, that is, preterm birth. So actually, when I said this the other day, to my children, they said, does that mean 1 in 10? Yes, 1 in 10 babies is born prematurely in this country. And it's one of the leading causes of infant death, right? And so that just, when you step back to think about it, is what that data is all about, to ground that in reality. We have a lot to do to change this trajectory.
Yes, it's staggering. And this heat map really, kind of is eye-opening to see when you look at the states that got to be the Midwest, Texas, Oklahoma, really, and the South, Florida. But there's like you said, the Southeast that got an F.
Yeah. No, I mean, they actually failed, right? Like, listen, I've been in academics, right, my whole life. Like, they failed, right? So we're talking about 14 states that had increasing preterm birth rates, right? And realizing that where, this is happening, then you can get down into the county level of thinking about how can we make a difference, right? And how can we change it? But you have to know where you start from, right? And so that's what report cards are all about. And it's not really to be punitive to these states, but it's also to say what is happening, say in New Hampshire or in California, where they have a quality committee, where they are reporting on maternal deaths and diving in, where they are doing programming differently. So versus and where, what populations are living in these areas, right? And so it dives into all of that kind of data. And we know there are states where there's been a slight improvement too, right? So you start to say in those states where what programs and what are we doing differently there than we aren't doing in other places. So I find the data gives you kind of that overall sense of kind of the state of the United States, which again, D+, not good. And then when you look at what has been the trend, we're not improving fast enough. And then ultimately, you can start to think about what kind of programs could make differences, and whether that's in Georgia, or Alabama, or California, what do we need to do differently, and where you live matters. You can then look at our maternity care desert report, which came out in August, and realize, some of this overlaps, and some of this is about access to care.
Right.
But and then when you start really getting into it, you start looking at some of the racial issues that are really right. Like, you can't ignore that, that our healthcare system is not working, especially for moms and babies, especially for Black moms. They are 3 to 4 times more likely to die. Infants who are born in this country who are Black are 2 times more likely not to make their first year birthday. So there's lots of data points right, and that's soul crushing, right? Like, and if we solve for Black moms and babies, we solve for everybody. So we really need to sit down and look. That's why this data is so important. That's why it gets quoted by almost everybody, because we need to. This is our benchmark, and we need to do better. We need to do better for our moms and babies.
Yes, exactly. Let's talk about the Black maternal health crisis. So you shared some statistics. I found that Black women face 3 times the maternal mortality rate as white women. So for every 19 white women, there are 18 Hispanic women and a staggering 55 Black women out of 100K live births who will have a child who passes away from preterm causes. And oftentimes these are preventable. So you mentioned maternity care deserts, where there's like limited to no access to care for these patients, and systemic racism is another cause. What in your experience have you found actually reverses all this? How can we help these communities?
Well, first of all, if I had that answer, kind of like, right, we'd be done. And I think that it speaks, right? It speaks to that there isn't just one answer, and that there isn't just one thing that will reverse this. And there are states, though, that are doing better than others. Access to care is a huge issue. Maternity units are closing. Maternity care desert, we should take a step back and probably tell you the definition, right? Yeah. That is a county where there is not a provider, an OB, place to see as a pregnant person, to see a provider, an OB provider, or to deliver in. So there isn't a birth center or maternity care in a hospital. And we've seen these units closing across the country, and realize where these are happening across the United States. We're seeing, that these are places where the distance to drive is astronomical. Yeah. We know that emergencies, really, if you look at it, we think, from the obstetrical side, since I'm a doc, is thinking like you need to be able to get a baby out and know in 30 minutes. So these are places where people are driving hours and hours. So they're not only are they not getting their prenatal care, if there is an emergency, if there is preterm contractions, if there is, like I said, an obstetrical emergency, they're not able to get, they have to drive these extraordinary distances past hospitals that, don't have an obstetrician or a midwife to be able to help them. So it's a crisis of access, but it's also a crisis of racism, and we know that that's part of this. And we do a lot when it comes to implicit bias training or trying to elevate about getting that we need a lot of differences in our systems for Black and brown women. So you're talking about doulas or access to midwives. So when you start talking about like the why behind what's happening, hospitals are closing, it's providers not being in places. A lot of that comes down to financials. A lot of that is nursing crisis that's happened across the United States. We know that obstetricians have been, not wanting to go in this field for some time. We know there's a crisis of that's been predictable, that we've been looking at for years. And when I say we, OBGYNs have known that. Then you add in that this becomes, really the Black and brown focus is that we need to be focusing in those places. And so we're doing things like bringing mobile units so we're going back to like the home, bringing doctors to the patients, Yeah. So we're doing that across the country with March of Dimes, and we've been really proud to be able to do that. It's almost like having a pop-up clinic.
Right.
That's kind of right.
Right.
But we're also doing things like implicit bias training and actually training providers, nurses, about how the differences in culturally competent care. That's really, really important. And we do that in medical schools and in hospitals across the country. So we're hitting many layers of it, and then we're obviously advocating for moms and babies,
Yeah.
just like reauthorizing the Preemie Act was so important. There are many other things like the mortality and morbidity review committees in states. Those two are certainly important that we advocated to in our testimony over the summer. That really helps getting to the nitty gritty of the data behind it and really helping states get to other things that could be helpful. We're doing some really cool projects in each of our different states. We've got a big one that we're launching in the South in Louisiana, really looking at the economic trends and helping with food insecurity. So you would say, what? Well, that actually makes a huge difference for prenatal outcome. We're doing great things with the Stork's Nest. We work with the Zeta Beta Sorority Incorporated. It's a fantastic, all the Stork's Nest. We've been working with them since 1971 with the March of Dimes. Great partnership, trying to incentivize women to get prenatal care, but actually handing out things like diapers and other things that people need, right? It's a really fantastic program that we do with the Zetas. I always encourage everybody, Google the Stork's Nest. It's a fabulous thing. 1971, like what a long, strong history. And they've been a great national service partner for us, not just raising money, but actually changing how prenatal care gets done across the country.
Yeah.
So lots of things we're doing, Kanika. We have so much, but there isn't one, to your original question, which I really kind of like went in circles around, right? Because there isn't one solution, and we're trying to get out, something that starts as a pilot and then really expanded across the country. And the mobile units has been one of those strategies.
Yeah.
And the Stork's Nest has been something that's been successful in years past that we're obviously pivoting and changing in the future. But it gets exciting about what we're doing and what we're trying to accomplish.
Yeah, that's wonderful. I wanted to take a question from the chat. So Miss Angela writes, my daughter is a midwife assistant in school to become a licensed midwife. The rate of issues is far lower in comparison to hospital-based deliveries. And I know I was listening to another podcast that you featured on where you talked about how March of Dimes and you as an OBGYN have worked with doulas and midwives. Yeah. So tell us about how there is actually in tandem care being provided to.
So on a personal note, I trained at the University of Rochester, just a slight plug, for the medical school there, and both medical school and residency. When I did my residency, there were 8 midwives that trained the residents, and actually think that it was phenomenal care, and a different, right, and looking at it through the lens of how can that be that tandem care or that partnership to really help those patients. And then I worked in academics for a little bit, but in my private practice actually had 3 midwives who had their own, really their own practice within our practice, and really did phenomenal care with patients and would follow them even if that patient needed, an obstetrician to step in. They were there the entire time. They're focused a little differently when they come in for prenatal visits. I always encourage any of my patients to always go see a midwife because I think the education they provide, their perspective is completely and utterly different, and I loved it. And I think it is something that we have to continue to advocate and actually not only get reimbursement to be elevated, but I also think when they deliver in birth centers, when they're, when they're working in tandem, it's an incredible solution that can help, right? It's one of the solutions. I think doula care is a whole nother one. Right now, the March of Dimes is doing a very large project with CVS, which is really exciting. It's multi-year, and it's really looking at training, but really about, to me, the integration into the system, because doulas can be incredible partners. We've seen those outcomes. We've seen them even as virtual doulas. That just got published in the American College of OBGYN, right? And Maven Clinic did those. So there's so much work being done around doulas. We are really looking at from how can we also support them for their livelihood, right? Because this becomes your career. Let's also have them not burn out. So provider, that's really important. And then really thinking about, so again, multi-year, multi-state project that we're hoping lots of data comes out that's helpful to be able to get the supply and the demand to match as well.
Mhm.
And then to really look at those outcomes for moms, lower C-section rates, lower preterm birth, things that we know. And then I should take a step back, because doulas are really should be part of the system. They're antepartum, so while you're pregnant, during delivery, and then after. When we think about all those preventable, right, like deaths and outcome morbidity, I think about how that could really change the trajectory. A lot of moms, and we just need to be better advocates for them, but also to really elevate into the mainstream. And I think they're there. I just think they're, as you'll see companies that are starting to pay for them, which is exciting, and insurances and states, like you start to feel this momentum building. So we want to be part of that solution. And so we put together a really great project. We launched it last year. It's multi-year. You're going to hear a lot about it. We've put out, big calls of action for other doulas to help join with us, to really make sure that we're standing up loud to say that needs to be part of the solution for moms, for all moms.
For all moms. That's excellent. And is this something that typically European countries do? Because I want to talk about another stat. According to the CDC, out of every 100,000 live births, the U.S. has 32.9 deaths. And this is 3 times as much as what you would find in France, which is around 8.7, followed by Canada, the UK at 6.5. So it's, exponentially greater. Yeah.
Right.
But what is it that these other, nations are getting right that we can take a cue from?
Yeah. So I did a program based on a program that was in the National Health Service in England. Back in 2017, I launched something called the Enhanced Recovery, which is something they do in the United Kingdom, right? So when you have a scheduled C-section, they give you a midwife who actually follows you, right, before, during, after, makes sense, right? And actually does a home visit for you and your baby. So we mimicked that. I mimicked it here with an app, because we didn't have enough midwives to be able to do that, and couldn't do it. But transforming that, we actually reduced opioids by over 70%. We reduced hospital stays, which was fantastic. It kind of got me really excited about doing things differently. And so when you look at, and collected lots of data using the app, which was really a lot of fun and partnering, and honestly, right, it took me a long time to figure out how to use this Instagram. You're probably thinking, you put together an app? Yes, I put it.
Yeah, that's amazing. Oh, wow.
But thinking about it, when you step back and say, this is a program that they were doing in 2013-14, their big publication came out. A gentleman named Dr. Ian Wrench, I actually picked up the phone and called him, and he took my phone call. And that's how I learned about the program. He wrote this fantastic article, and I was like, we should be able to do this here. So we were, myself and a gentleman named Dr. Kett, one of the anesthesiologists, first to really launch it in the United States. And it's now really become a standard for most scheduled C-sections. And it's a different way of doing things. Like, you don't get starved ahead of time. And really, the pain control is different, and moving and getting up is different, and the focus around mom and baby at the center. So if you think about it, taking a program like that, and again, launching in 2017, and now 23, 24, it's really become standard, really got elevated during COVID, because it kind of made a ton of sense. You can actually say, like, we accelerated some things. This is the same thing we need to be doing for other things that we're not doing well. Prenatal care is different in other countries. How they do it, how they actually help moms, right? When you think about, I think it's Denmark sends a whole package after they deliver with baby items, right? And so, and again, different countries, different taxes, different, right? Like lots of things to think about.
Yeah, all of that.
When you think about, when you look at their outcomes data, we're clearly not doing something here that we should be doing. And we're not, and when you take a bigger step back, Hanukkah, this is when I really say, we're just not prioritizing moms. And we don't think, right? We don't think that mom and baby, like when you take back, moms make the major decisions for households, right?
Yeah.
Where, right? Healthcare decisions. So if you think about, they're not taking care of themselves, or they're not taking care of their, for prenatal care, what does that say, right? What does it say about us as a country? And I've had people say, well, if there's no access, can't they just move closer to a hospital? Or like, okay, what are you, did you really? So
Everyone's uprooting themselves. Yeah,
yeah,
that doesn't make sense. There
that's
needs to
not
be
really
access to
right. That's
care
focusing on the
universally.
system, not really looking at the family and the mom, um, and what it takes to really get this done. And I practiced in, parts of Alabama, and I think about the distances people drive to come see me as a provider, um, and really the state of prenatal care, right? It's preventative care. That's what prenatal care is, to get better outcomes. And I think that's where we have to flip this switch here, and really think about it in that perspective. And there's so much we could learn from France, who does things differently in the third trimester, for instance, what their testing is. There's just a lot. And also just how we get education to our patients. And we have to
Mhm.
really start thinking innovatively, differently, and really focus on those outcomes. And I'm excited about March of Dimes being, part of the change and part of trying to lead getting the word out, some of our great programming, of what we're trying to do. I mean, I've only been here for a year, but really excited to watch where we're going and what we're trying to accomplish.
Oh, wow. Yeah. 100%. It's great to be part of it. And it's an honor to be partnering with March of Dimes in this way, to be able to disseminate this information to the audience on social
Yeah.
media. I think we all need to be plugged in.
Yes, no,
Hmm.
I appreciate being here, right? This is one of the avenues or channels that we need to get to. And, I think about how we can get patients into prenatal care, because that absolutely, and how important it is before you get pregnant to really go in and discuss your medical conditions. Women who didn't know they were diabetic or hypertensive, all those things, better control means better outcomes. It means preventing birth defects, getting on folic acid ahead of time. So anything we can do to get education out there. This is new for me, being on Instagram, so I'm
Hmm.
all laughable that I'm like late to the game, but we're getting there. So
Yeah, no. You're doing it. You're doing it. And we're so happy you
well,
are. Um,
appreciate it.
yeah.
Appreciate having us. Yeah, absolutely.
This month is National Birth Defects Awareness Month. What is the organization doing to kind of promote awareness and garner support?
Yeah, we've been partnering with the CDC for several years to do, around January, because of just getting out the word and really realizing that 1 in 33 babies is born with a birth defect in the United States, that some are incredibly preventable.
Mhm.
Things like smoking, things like alcohol, which, I couldn't believe I read the statistic that I think it's 1 in 4 or 1 in 5 moms has binge drink during their pregnancy. Like that's a problem, right?
Right.
Like smoking, right? Something that I think now we know, right? So much information on and so we're doing a ton of webinars, tons of education. I've got a huge media day next week, doing tons of work there. Just trying to get the word out. And really, one of the things I always love to talk about is, in North Carolina, we have been handing out folic acid prenatal vitamin to moms. And when you look at that
Wow.
statistic, which really you're preventing spina bifida or neural tube defects, that statistic has reduced significantly more in that state than any other. And we've been handing out prenatal vitamins and folic acid for 10 years in that state. I get so excited about that kind of. So
Yes.
that was one of the things I had to
Yeah. That's the proof of the pudding.
redo on a yearly basis. And every time I sign it and I read that stat, I just think that's the kind of impact that you want to have in a community. And we know we're not going to get, everything down to zero, but we know if we can do an intervention that is in the community that will impact, we want to be doing it. And so we're excited to be doing things like that. And that's the type of thing we promote, right? Is making sure people are taking folic acid,
Yeah.
even before they conceive, right? And then throughout their pregnancy. So, yeah.
Great. I want to kind of touch on you and
Oh,
your experience. You are an OBGYN and mom, and
yeah.
I feel like you have a unique vantage point being the president and CEO of March of Dimes. So tell us about
Yeah.
that and why you're
No.
so invested in the work.
Yeah. No, kind of. I'm a mom. I have two young adults, teenage. Well, I guess one's 20 and one's 19, so
Hmm.
college age, right? We, I went through COVID like everybody else, but I've also been, so as my kids in high school, but then you look all the way back, like, yeah, I brought home a newborn and had no idea how to like take care of it. I remember the umbilical cord and going, what am I supposed to do with this? I usually just hand the baby off. I don't really know what I'm doing here. But I had preeclampsia with both my children. And so I know that I have a risk of hypertension in the future and cardiovascular disease in the future. So, those are the things that sort of ground me in the work we're doing and the things that we need to do for other moms. I remember going home thinking, I wonder if I should check my blood pressure, right? And I'm a doc, right? I should know, right?
Right.
So, and and it came up and totally surprised me. I mean, I looked like a puffball. I had vision changes, and I was like, "There's no way this is great." And then my second pregnancy, kind of the same thing happened right around the same gestational age, and I was like, "No, this," and luckily did very well, like, and had good outcomes. But it definitely grounds me in what we do every day. So I have been on the bedside, right, and then I've been the patient, and then I've been through the rigmarole of being on the patient side. And trying to figure out how to even get discharged from the hospital and get my instructions and all of that. So there's got to be better ways of doing the things, right? And then I've been on the financial side running, a large group of OBGYN. So I think my vantage point is definitely different. I definitely have a different trajectory role than a lot of docs. I love being at the bedside. I love being able to manage fiscally responsible business, but also having large, big impact. And so being at the March of Dimes and having that, I think, as a physician, which I'm the first physician to lead the organization, but also just as a mom, I know exactly what it's like to take home your newborn and not have a clue. And it's a lot and overwhelming. I know the mood swings. I know the, feeling like complete, that you really, for me, that was probably the first time I felt incredibly inadequate, right? I felt incredibly trained as
trimester.
Yeah, I was not trained to change a diaper, to look at an umbilical cord, or I remember I think it was called cradle cap. My daughter had like that, and I was like, "What is that?" I mean, I had been through pediatrics, right?
Wow.
As a rotation, like, so I remember being like, "But yeah," but listen, I also, I could look at an eardrum and tell you if there was an infection, but I never did on my own children because I felt like, I should be. A parent, right? But it's hard. It's hard to not do both. But I went through the trials and tribulations of breastfeeding. That is like, and a major project. That's like a full-time job on top of a job. So, right? So I think my vantage point is very, and I would tell you, I love being a mom. It's, one of the things I feel, and I'm not finished, right? You think you are, but you're not.
It's a forever job.
And all the insecurities you have as a parent, they just never really end. And you're never, you're only happiest as your most unhappy child, right? And so I've, navigated COVID in so many ways. My daughter is actually a type 1 diabetic. So I've navigated a chronic illness, or, that has continued, and then had to let my daughter manage it, right, in that way. So I've navigated the ADD of my eldest. So I've been through and feel like all of those things kind of ground you. Someone once said to me that, you're tested only so much. I feel like it's just kind of life, and I like talking about it and sharing it. I think what you do is fantastic because shared experiences really help you along the way. It took me a long time to talk about both of my kids, to be honest, especially my type 1. The ADD, probably a little bit, as I was like, okay, somebody's got to help me here. Like, these are all now, through all that, being a mom really tests you in so many different ways. Like I said, proudest moment for sure. Most tested moment as well. But I think the shared experiences that you get to share and find out, like we all are going through a lot. So anyway, those are all the vantage points. So yeah, I have a very interesting place to be, and I can talk about, with moms all the time having to go through these challenges.
Yeah.
So.
Well, I think, being a patient, I feel because you relate to me on this level, there's an inherent respect and a leveling of the playing field, and I love that. You know,
Yeah.
and I think I'm speaking for others when I say that not only are you leading this national organization, you're a mom yourself, you've been, you know, you've given birth, you've done childbirth,
Yeah.
you know, and delivered babies. And so,
Thousands.
yeah,
Thousands.
yeah,
Yeah.
yeah.
Yeah. Yeah.
So I just have that much more
You're sweet.
respect for you because I feel seen,
Yeah.
you know.
No, that's
It's
kind.
great.
Yeah. No, I actually I heard from a patient this morning that I have taken care of. I delivered and just you know, I mean, I delivered her 17 years ago. She
Wow.
just reached out. Yeah, no, and you know, there's a you know, some patients had my cell phone just because of their story or what was going on, right? And there is I love that you said you feel seen because that's how I hope I made my patients feel.
Yeah.
So absolutely.
Yeah.
Yeah.
Do you have a mom sense moment you could share? And by that I mean, I feel like we all sometimes second guess ourselves, but when you trust that intuition, it steers you on the right path. And that's your mom sense, your dad sense, your grandma sense, whatever you want to call it. But it just is your North Star. So what
Yeah,
was
no,
one moment where your mom sense kind of
yeah. I mean,
changed?
I think there's probably so many, right? There's also
Mm-hmm.
didn't know, right? Like there's that,
Right.
and that, you know, and then, you know, I probably think back to probably first or third grade, somewhere in there. I can't remember with my oldest, who you know, I knew he was struggling in school and just thought, and again, this is like nothing compared to the type 1 diagnosis, which was more of the medical, like, right?
Mm-hmm.
I missed, by the way, right? Like, so, or didn't diagnose right. And the doc did, and I knew something was wrong. But more on the educational side for my son was like, okay, he's struggling. He's really struggling. And you have to push and advocate really to say, you know, and I just said, if he gets a computer, I think he'd be better than, because his handwriting just wasn't so great. And it was, and he, you know, they were putting him through physical therapy, occupational therapy, all of this. And I finally just said, is there any way to, and this is, you're talking, you know, over whatever, 18 years ago, saying, let's get him a computer, which nowadays everybody has, right?
Yes, yeah, but that was, yeah, groundbreaking for back then.
Exactly. Like even using like Google Classroom and sharing, like that was all new. And I had to be like, no, this kid needs a computer. He can take my computer from work, give it one day. And this is a kid who probably wrote maybe 6 sentences on a piece of paper because his handwriting was just a struggle.
Mm-hmm.
And he went from that to like 250 words in one day. And his teacher, right, his teacher, like on a, you know, something they asked him, he just started finger type, right? I like had tears in my eyes saying like, I wish I for it sooner, but I also had that moment of like, you know, your child best.
Yeah.
Your gut feeling is always right. It's something I would honestly say to moms when they would go home, to say, in the end, if your gut is something's wrong, you have to advocate for them because they can't, right?
Yeah.
So, and I will tell you, so I feel like I've instilled that in my children, so much so that when my son was in 6th grade and was with a teacher who didn't know how to use Google anything, actually scheduled an appointment, a whole like teacher student with me. He called me and said, what's your schedule? I was like, I'm post call on Thursday. And set up, and I was like, what is this? And he was like, I need to change teachers because she can't help me.
Right.
And I was like,
oh, he's advocating for himself now.
And I was like,
yeah.
Great.
Wow.
Like what a great thing to have learned. And I feel like that was a moment I said, like, he's figured it out. And if you figure that out in 6th grade, like you're set, you're going to be fine. You're fine. You're totally going to be. So yeah,
exactly.
So that's a longer story of like, but I think, you know, and I could go back to like, honestly, I had no idea how to take care of the umbilical cord and was like terrified of it. Right.
Yeah.
But, or the cradle cap, I was like, what is that? And was, you know, it really, when it came sort of for the school time, that was harder for me. And probably feeling like I wasn't home enough and all that. And my husband did a ton, but really, you know, that was the moment of like, okay, you know, I have to advocate for my kid. And that was the moment of like, this changed everything. And it changed the trajectory of my child's education, to be honest.
Yes, yes. Oh my goodness, that's brilliant. I love that. And you've set them up to be able to advocate for themselves. That's
It's
all we ever
important.
want.
Yeah,
Yeah.
I think, listen, I think, especially now my kids are in college, right? And through high school and COVID, I think it had a bigger impact than people realize, both
Yeah.
socially as well as academic. Like the academics, I don't like that one can catch up on, right? I think socially it sort of changed stuff. I think social media, like all, masking and separating and all the different rules for all of that. And then, landing in college, and I look back on like, my days, or my husband and I talk about it all the time, it just didn't seem as complicated.
Right.
So yeah.
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 So
Yeah. They've definitely had
yeah.
to go through more trying
Yeah. So
times.
we all have to have some grace, right? Like I think
Yeah.
that's part of like how like and again, that's just sort of with what I think of with myself and I try and instill in my kids of just like you got to give other people grace, but you have to give yourself some grace. Like this is all new challenges that come up, and anyway,
Yeah.
I'll probably philosophize more about going to college, but yeah.
Oh, it's such an exciting time. I'm just excited for you. That's awesome.
It is. It's fun. It's fun to watch them grow. I mean, I was so excited to watch my kids read. Like I remember we're both in New Jersey, Kanika, so we lost
Right.
power, right,
Mm-hmm.
for 14 days in and I remember going, like the diner gave you like a discount if you went. And so Hurricane Sandy came, wiped everything out. I was, took our kids to the diner and was so excited to have electricity and eat like a warm food and sit in. And we just read Harry Potter. And
Wow.
no TV, no nothing, and passed the book around and just read. And the waitress was like, she's like, stay as long as you like. I was like, it's warm, light, right? Like it's food. I think we had breakfast and lunch, you know what I mean? And but it was a moment of like, okay, my kids really know how to read, right? And like they're reading to me, and it's just those are like things I look back on and think about just as a parent, like, that was rough. 14 days not having,
but it was a core memory.
Yeah,
that's a core memory for all of you.
Yes, and so we read the I don't know, the one with Sirius Black. But anyway, the long story here was like, it was such a moment of like, I really enjoy my children. I love being with them.
Yeah.
And I love being like, they can read to me, right? Like I'm done.
Right. Oh my gosh, I know. And a story, like a series we all enjoy.
Yes.
Yeah, that's so awesome. Well, I guess bringing it back, how can this audience tuning in now, thank you all for being so engaging and for your questions. How can we all get involved with March of Dimes? I know there's March for Babies, the walk, there's donations, advocating, supporting research. Tell us all the ways.
Yeah, so if you go onto marchofdimes.org, that's an easy way. You can certainly sign up to actually help raise money for us with March, March for Babies. That March comes up faster than you think. The walks are fantastic. I went last year to the one in New Jersey, New York, the one in DC. There are ones across the country, Texas, Houston. I mean, and those are great ways to meet the community. You can also do virtual if you want, and but also get involved in looking at all the data that I mentioned today, both the report card as well as the Maternity Care Desert report. I think knowing what your community is really important. There are ways to be a grassroots advocacy. There are ways to get involved in both the education. You can listen. We have a modcast, a play on podcast on our research if you want to know what we're doing. And I will tell you, some of them are fascinating, and they're not just for the deep researcher. I think I actually did this month's modcast, so it's kind of fun. A little bit about my background, but also more just the March of Dimes. And so you can get onto our website and all of it is there. You just have to navigate and spend a little bit of time, but it's not just donating, which of course we're not for profit, so we want that. But it's time, talent, right, are the other options. So, and we want people involved. The more we have engaged in this, think about that, in 1938, when they all, asking everybody to mail in a dime. Imagine if everybody did something in the United States, how we could turn the corner on the maternal and infant health crisis. So I think of like, time and talent is one other aspect of it. It's not just your treasure. So I would tell people to go there, and you can download our educational material. You can forward it to friends. You can get involved in multiple ways. So yeah.
Yes. I wanted to share a quick story. I first learned about March of Dimes when I was the vice president of my National Honor Society back in Maryland, where I grew up.
Yeah.
And we decided to do the walk in DC, and that was the nonprofit that we were supporting. And it's like a full circle moment that I get to do the walk again with my kids. And it's just, for generations to come. I feel like we can all support what March of Dimes stands for, and when you become a parent, it hits home. So
no, Kanika, you brought up, we have tons of it actually in colleges too that come out to the walks, knowing they're future parents, right? But they can help support the neonatal intensive care unit, our NICU family support programs. What's really fun to watch is exactly what happened to you, right? You watch moms, families, their children, and the NICUs come out and walk, and you see that reunion. It's amazing. And then you see the corporate sponsors, or the sports people who are involved, like we've got some great advocates out there, so it's a lot of fun. They become I was in the one in New Jersey rain this year, but it was still a ton of fun to go and see and be a part of. So I think again, it's your time that we ask for more than anything. But I think the walks are so impactful, and we love that we get new people bringing in, coming into the March of Dimes that way. So.
Yes. Well, all the best with the initiatives in 2024 and beyond.
Thanks.
We are so thankful to have you at the helm. And thank you so much for talking with us today and sharing your
this
insights.
was great. This was my inaugural, Instagram live. So
many more.
Sounds great. Thanks so much for having me. Appreciate it.
Thank you, Dr. Cherot. Bye, everyone.
Bye.